Good afternoon. We'd like to welcome you this Friday, August the 7th, to the Healthy Flint Research Coordinating Center Flint Community Webinar on Coronavirus. And we're excited again. We hit that major milestone last week of 20 webinars consecutively. And today we're starting this journey of 21. We've got some special things that we're going to share with you today. And I appreciate all of you that have joined in and welcome you. I'm your moderator for this session today. My name is Yvonne Lewis. I'm the co-director for the Community Core of the Healthy Flint Research Coordinating Center. The Healthy Flint Research Coordinating Center has four strong cores, which we've mentioned to you, the Community Core. We also have three institutional partners, University of Michigan Flint, University of Michigan Ann Arbor, as well as Michigan State University, working diligently to ensure that we bring information with you. It's a global problem that we're dealing with, but it certainly has very important issues to our local community that we want to make sure that you are aware of. Today, we have, again, we want to appreciate the partners who participated with us these 21 weeks. And this is just a list of the partners that have been on for this entire week. And we're just really trying to figure out how we can continue to provide appreciation as we add new partners to this list every week. It may take us a couple of slides coming forward in the future to get them all on, but we do have a new partner joining us today along with all of these. And for those of you that are joining us by phone, you may not be able to see all of these, and I won't list them all today, but hopefully you'll have the opportunity to go on our website or go and view a YouTube video of this and see the wonderful partners that we've had participating with us for the last 20 weeks. Today we'll add a new partner, Genesee Health Systems. I want to then also let you know, along with these wonderful partners, each week panelists from these organizations come on to provide additional information as well as respond to any questions that you might put in the question and answer queue. We do recognize that some of you join by phone and may not be able to see all of the slides or even to see some of the questions that come in the queue, but we want to let you know that you can go on our website and ask any questions at all, and that's Healthy Flint Research Coordinating Center, info@hfrcc.org. You can send those questions in, or you can give us a call during the webinar at 810-835-2130. And your questions, if you text them in, they will be answered during the webinar. So we have an array of partners that will be ready to answer and respond to any questions that you might have today. Let me one more time say to you, the goal for this webinar is to bring a local context to this global pandemic and even some of the other larger issues that we have present in our community, such as the water crisis. And another thing we'll talk to you about is, again, continuing conversation about the census and how that will affect us here in Genesee County. As we move forward today, we had with us last week representatives from the Flint Community Schools. Anita Stewart, who is the superintendent of Flint Community Schools, is not able to be with us. Neither is Tricia Hill, but we do have a message for you on behalf of on behalf of Anita Stewart from the Flint Community Schools. We all know that the Flint Community Schools did open up online on Wednesday of this week. They do have a safe return and recovery plan available for all residents to view on their website, which is www.flintschools.org. If you have concerns about how you schedule your student for enrolling, you can call them at 810-767-6158. That number again, if you're listening, is 810-767-6158, or you can visit their website and click on centralized enrollment in order to find out how to enroll your student in Flint Community Schools. If you need any other information generally, you can call them at 810-760-1000. That's their general number, 810-760-1000. We want to just give you a few tips of what they have on their site for you to view if you go on regarding the opening of Flint schools. They are opening them up in 3 different versions. They have a complete virtual version that you can look at, and that's the number 3 item on our slide here today: virtual instruction, online learning through a laptop or computer. The students will attend a remote location while teachers lead virtual lessons. And so that is an opportunity. The other is a hybrid learning situation where there's a combination of virtual learning and face-to-face. Students will report to school on select days, or they can select periods of time that they will be either in the school or having their virtual education experience. And the ultimate, of course, we all know at some point our children do well when they're face-to-face and there's face-to-face instruction. There's a traditional approach to student learning where students attend school in person each day. Bus transportation will be available, but ridership may be reduced day to day based upon the student's assignment and their assigned seat. Sanitizers will be available when students enter the bus, and buses will be sanitized between routes each day with deep cleaning daily. So there are 3 opportunities. If you have questions, please be sure to call the school and get clarity on how your child will participate in their educational experience for the beginning of this 2021 school year. I also want to remind you that Tricia Hill from the GISD advised us that all parents should contact their particular school district to learn about the special arrangements that are being made for that school. Even for our charter schools are also making special arrangements to educate our students. If your child is in a charter school, we encourage you again, please call that school directly to learn exactly what's happening in the schools for your students. Our ultimate goal is that our students are safe, so that our community is safe, and we must continue to follow the guidelines that have been outlined for us. So we appreciate our school systems for working with us. They are unable to be here because this is Friday, the first day of school opening. A lot to be done, but we certainly appreciate them providing for us these insights for our webinar today. We want to continue to talk about what's going on in the city of Flint. Dr. Reynolds has always been just an expert in sharing with us detailed information about the city of Flint, as he is the health advisor for the city of Flint. And he will also lead us into a discussion that we will continue regarding the census. So Dr. Reynolds, would you please share with us now?
Oh, yes. And there's a correction on the slide, and that is for Fast Start lead service line. You should call 232-2558. The window on getting a lead service line replaced is closing. We're trying to get this done by December 31st. So if you have not had your lead service line replaced, you should call. If you had said no initially and you've had a change of heart, you should call. If you've moved into a new residence, you should call. There is a website, flintpipemap.org, where you can check your address, and you may get the more reliable information if you have absolutely no idea what has happened. It's not 100%, but it is a definite improvement from where we were 5 years ago. So I'll repeat that number for lead service line replacement, 232-2558. There are other services that can be offered, and I'll go into that at another broadcast because I see we have a heavy load here. I'll just repeat the message. Get your immunizations up to date. Plan on getting your influenza vaccine as soon as possible, because I don't care how much experience I have, I cannot distinguish COVID-19 symptoms from influenza symptoms. But if I know you have an influenza shot, I can focus, a provider can focus on diagnosing COVID-19. Testing will be more widely available, and I'll let my colleague from the health department speak on that. And please, if you have a computer, if you have time, the Genesee County Health Department has an excellent website for COVID resources. And you have to spend a little time moving around it, but once you get familiar with it, there'll be enough information for you to publish a book. Thank you.
Thank you, Dr. Reynolds. And I want to also say that Ian Robinson from that, which is from U of M and Blue Conduit, is available as a panelist today, and he can answer questions for you that you might have about the pipe map. And we will certainly put that information up for our next webinar to be sure that we continue to keep that information in front of our viewers regarding the pipe replacement program, as well as the phone line for them to call. Thank you, Dr. Reynolds. Now, we have with us again today, Anthony Turner. Anthony Turner talked to us in great detail last week about the census. And we want to start today bringing you up to speed on something critical that we just mentioned last week, that there was potential of changing the date of the final census count. So Anthony, if you would unmute your mic and let's talk about this for a minute, because that actually did happen.
Yes, good morning, good afternoon to everyone. That actually did happen. That was a directive directly from our president. And we must understand in Black and brown communities, especially African American communities, that this is just an extension on the war on civil rights, which includes our voting rights. And this is something that was purposely done in order to hinder a complete and accurate count in urban neighborhoods, specifically Black and brown neighborhoods. That being said, when we look at that statement and look across the nation, when you look at African American, specifically African American neighborhoods or cities, they're trailing their counterpart, their Caucasian communities by at least on an average of 10 percentage points. So what does that mean? That means that right now, going into a era of enumeration, we have 4 in 6 households in Black communities that have not been counted. So that means that the Census Bureau is going to have to do several things. They're going to have to really press their enumerators to do more work in a short amount of time. That's one. 2, also understanding that these workers should be coming from our neighborhoods. So it's really incumbent on the city of Flint and our partners to make sure that the Census Bureau is hiring folk from our neighborhoods that will work in their neighborhoods, that are used to the neighborhoods. The other piece that we got to understand is that by them shortening the period, it's going to really hurt the count, because now the Census Bureau is going to have to rely heavily on neighbors to get a count. What does that mean? When an enumerator comes out starting next month, they have 6 opportunities to get in contact with that household. If they don't get in contact with the household, they have about 3 attempts, I believe it is, to talk to a neighbor to see how many people are in that household. As we know, people are very reluctant to speak, one, about their own households, but to talk about somebody else's household, that is going to be an even larger barrier to get across. So then 3, if that doesn't work, the Census Bureau is looking at going to administrative records, i.e. Social Security, IRS data. Now, the problem with that, in these hard to enumerate areas, these areas includes households that are undocumented, people in poverty, poor, and these type of folk, they basically go on a cash basis. So when you talk about cross-servicing documents, you're going to get an inaccurate count. So these are the things that shortening the census time to make a complete and accurate count has put barriers in our path. And it's going to be up to us in the city of Flint to put all hands on deck, and to make sure that we all as a group work together to get a complete count.
So Tony, let's go back to the previous slide for a moment. We talked about the dates. Initially, it was October 30th was the date that the census count would be ending. But now, if we can go back to the previous slide, Tricia, with those 3 items there, it is now ending on September 30th versus October 30th, right?
Yeah. Right.
Means we have 55 days left. So today we want to start the countdown, and every
Yes.
week we'll try to bring you up to speed. But we have 55 days left. That means we have 55 days to ensure that everyone is counted. And then
Right.
we show you here that on August the 13th, that's when the enumerators, those persons who will come, as he mentioned, that will be knocking on your door to ask questions. So we want to make sure, as in this next 6 or 7 days, that all of us who can complete the census on our own before an enumerator comes out. This will be our first challenge, if you will. Our challenge is to get as many as we can. And as we move to the next slide, we want to show you a little bit about why that's important. Tony, you mentioned in conversation that we had that when we talk about our community, it's divided up in wards and then further by census tracts.
Exactly.
So the slide that we have here shows the wards, and then you can see the different colorations that give us a little bit of a glimpse of census tracts. So can you talk about what this means and how we will actually keep and monitor what's happening in each of these census tracts?
Yes, and that's the shift in conversation that we've had over the last week and a half is how can we better razor focus on where we need to place our passion, commitment, and resources. Wards are representative. That's, we have ward councilmen. They represent let's say a city, we call them city blocks or city wards. But the census tracts is where, like, for instance, in Ward 9, we have approximately 1, 2, 3, 4 census tracts in Ward 9. And the reason why I am proposing and strongly recommending to the Complete Count Committee and our M&A grantees that we stop looking at wards and start looking at census tracts, because in that census tract, we have three census tracts within Ward 9 that is performing very well. But when we look at the area of the census tract, I believe it's 3,400. Let me make sure I'm saying it right. Yeah, 3,400. That is bounded by Atherton, Dort, Lippincott, and Term Street. That is a section of that ward that is poverty, stricken with poverty, higher unemployment rate than the rest of the ward. So thus they are responding at a lower rate, which currently their response rate is 28.9%. So we have 16 of those census tracts spread throughout wards 1, 2, 3, 5, 7, and 9, 16 census tracts where the response rate is about 40% or below. We must focus on those specific tracts to bring those response rates up. If not, those tracts will bring our response rate down overall, and Flint will not retain its Tier 1 status, which is very important, and it will not retain, most likely, the congressional district will be vulnerable, very vulnerable.
Now, Tony, you're giving us a lot of information that we'll have to come back and talk about next week. So we want to talk a bit about next week about Tier 1, so we clearly understand what that means and how we break these census tracts down a little bit further. But what we want to do is give you a count. So if you come back next week and we've done well, you may have to go online and identify where you actually live in the census tract so that you can know to talk to your neighbors. But we want to just challenge you a little bit to take that extra time to do that investigation and see what you can do to help us improve those numbers, because we'd like all of our census tracts to be over 50%. Is that correct, Tony?
Yes, and any of the people here that's not on this call or are on this call, I just sent out a report to our M&A grantees and the Complete Count Committee on these census tracts. So if anyone wants that, they can email me at census@cityofflint.com, and I will send you out the report on the tracts where we're at in these vulnerable tracts. I will send you out the tract map and the ward map. That way you can correlate where you're at better. And know where, yeah. Mm-hmm.
Thank you, Tony. So much here that we can cover, but we'll give you a little bit of it each week until we get to ground zero. But we've got 55 days. We want to work with our city and our county, our organizations. Many of us have been connected to organizations that are supporting the work of the census, just as we do here on this call. It's important that all of us, it's like all hands on deck. Everybody is important in this work. because it does affect the amount of resources that come into our community. And our Genesee County Health Department, who has been a fabulous partner with us on the webinars, has kept us abreast of the things that are happening with COVID, but they're also received support from the way our census is calculated. So we want to make sure that we are able to continue this work that we're doing. So Suzanne is our #1 star webinar person. She's on the ground and in the community, making sure that the information is available to us. So Suzanne, please give us the update for the health department today.
So hello everyone. It's hard to believe that we're already in August. We have a lot of planning that we need to do for the fall. I will share with you that as of yesterday, we posted to our website 2,904 positive COVID-19 test results and 270 deaths. I've been reporting to you that we are seeing a delay in the length of time it takes for people to get their test results back. It's averaging between 2 and 14 days, and it is very dependent upon where you get your test, which laboratory is doing the test result. And so we're seeing a significant amount of variation. That's significant for those of us who look at data, because it makes it more difficult for us to look at what's happened in the last 7 days. You can't accurately report information if it's taking 14 days to get test results back. So that's really important for everyone to recognize, and we're being very mindful about that. So when I talk about increases and decreases, I want you to all know that we're very mindful that it's taking up to 14 days to get those results back. So we can't accurately tell you where we are in a 7-day period right now. So I'll share that with you. I'll also share that we're seeing a slight increase in hospitalizations. Our hospitals are doing well, but we are hearing from some of our urgent cares and other providers that they've had challenges with the reagents to do testing and with the actual sample kits themselves. So as always, we're monitoring and communicating with our amazing partner with the governor's office, Gary Jones. He makes sure that all of our concerns get back to the governor's office. The other thing I wanted to share with you that the Genesee County Health Department, in collaboration with Oakland County and Livingston County, issued a media release this week. We have seen an increase in COVID-19 cases in the South Lyon and Fenton area, and specifically in the age group of 15 to 19. It's a great reminder for all of us to social distance and to wear our masks and to practice all of those preventive measures that will keep us safe from COVID-19. When we have large gatherings like prom parties or graduation parties, again, particularly with young people, it might be more difficult to social distance, continue to wear the mask. So those are important reminders to all of us why it is that we are practicing these measures so we don't see increases in cases of COVID-19. So that's a concern I want to bring to your attention and to remind you all about social distancing, wearing your mask, use hand sanitizers that are 60% alcohol or more, wash your hands, don't touch your face, wash frequently, touch surfaces, all the things that we remind you all to do because we don't want to see the increase in the cases. I'm going to also promote the same message that Dr. Reynolds promoted earlier. This is an excellent time for everyone to get up to date on all of their regular immunizations so that you're prepared and ready for the flu shot. I want to remind everyone that doctors' offices and our health department clinic are also practicing social distancing. We're working from appointments, so we're not able to see as many people in the same time frame that we normally do. So please call ahead. Please think about immunizations. Don't wait to the last minute. I'll also remind everyone that we, as a health department, are preparing for when there is a COVID-19 vaccine. So that means activating our emergency preparedness group. working on the point of dispensing locations in our community. Those are locations where people would be able to come and get a COVID-19 vaccine. We're talking about what are called closed pod sites. So those closed point of dispensing sites like nursing homes, certain school facilities, etc., where they could actually vaccinate the population that they serve. That means that we're working very closely with our partners to make sure that anyone has English as a second language, or those that are deaf or hard of hearing or have disabilities, that we are making sure we have plans to make sure everyone is well taken care of and can access that immunization when it becomes available. So that work starts now. We're connecting with partners, and we'll be providing you more information about that as this fall season continues to progress. Don't hesitate to get your flu shot this year. You heard Dr. Reynolds. We're going to have 2 respiratory illnesses at the same time. Take every opportunity to protect yourself, not only getting your immunizations, but also making sure that you're taking care of your physical health and your mental health. It's really important that we do everything that we can to keep our bodies and our minds in great shape. That will help protect us against COVID-19 as we enter into the fall season. Our health department is open in our Burton location for our clinic services. That's WIC, family planning, immunizations, and sexually transmitted infections. I remind you always that we are taking temperatures. We are asking questions. We're doing a lot of things via telephone, and we are social distancing. So those services are available, but we're not being able to see as many people as we normally do because we're keeping our waiting rooms light and making sure everyone's safe when they come to visit us. So please take advantage of all of those services. And if you have any questions, don't hesitate to reach out. Dr. Reynolds mentioned our website, www.gchd.us. We have lots of great materials that are there, and if there's something that you need and don't see there, you can contact the health department, ask for me, and we will do our best to make sure you get what you need.
Thank you, Suzanne. Our primary testing sites are still available for our community members?
They are. We are still having our testing at Rite Aid, in Swartz Creek, and in Flint. Hamilton Community Health Network has their North Point Clinic and the Burton Fire Station that's at the corner of Bristol and South Saginaw, and the Walmart Super Center, which is on Corona Road. We will have 3 faith-based partners coming up for testing sites in September. We will bring you more information about them as we get closer. We also will be looking for more what we call brick and mortar locations like the Burton Fire Station as we get into the fall season, so we're not operating with tents. So thinking about that, those are part of the things that we're planning for right now.
Thank you, Suzanne. It's so great. I want our listeners to know that Suzanne will continue to be on to answer any questions that you have. I see there are some questions in the queue, and right quickly that says, how can we encourage influenza shots during a pandemic? And both you and Dr. Reynolds have talked about that. So if you give us a quick answer on that, it may not be a quick answer, but give us an answer on that. And there are others who are also available. Dr. Tupper can answer questions for you. He's still here with us. Ian Robinson, as I mentioned, who is with Blue Conduit and University of Michigan around the pipe replacement program, MAP, the MAP. You might want to ask some questions about that. Dr. Reynolds will continue to be here for answering questions as well, along with Rick Sadler and Sharonda Grisby from the State Health Department. So Suzanne, can you give us a response to that question regarding the influenza shots during the pandemic?
All of us can be ambassadors of information into our community. And we all are hearing the same message each week that Dr. Reynolds and I bring to you about the importance of getting your flu shot. And again, recognizing that we're going to have 2 respiratory illnesses at the same time. So you can talk to your family members, you can talk to your friends, encourage them to get their flu vaccine. They're widely available through all of the pharmacy systems. You can speak to your doctor's office. If there are questions about it or myths that need to be busted, you can take a look at our website, look at some of those materials, and share them with the people that you care about. It's more important than ever that this season you get that flu shot and that you get it in a timely fashion. Recognize it takes a couple of weeks for you to build up the antibodies. So we want to make sure everybody is doing what they need to do in order to get themselves taken care of. There's a question about the cost of the flu shot for the health department. I will tell you that if you have health insurance, we will try to bill for the health insurance. But this season, we know we're going to have more immunizations, so more flu shots available for those who can't afford a flu shot. So we will be continuing to share more information. We'll also share information about our partners. We work greatly with Genesee Health Systems to provide immunizations, and they've been an amazing partner. So we'll continue to talk about some of these things. Our Genesee Health Plan as a partner, but we also work with Genesee Health Systems and also with Hamilton Community Health Network for individuals in our community who do not have access to insurance. So there will be a lot more conversation about immunizations as we enter into the fall season, but all of us can be ambassadors of health.
Thank you, Suzanne. And you also mentioned our partnerships. And one of the things that we were excited about is for those of you that are putting these questions in, it really helps us to make sure we're responding. And we had a request last week to talk about mental health and behavioral health. And we reached out to our partner at Genesee Health System, and they are here with us today. Katie Baxter, who is the Senior Director of Clinical Services, has been just wonderful in these last couple of days, getting us ready to hear about the services and programs that are available to us through Genesee Health System. So welcome to our webinar today, Katie.
Thank you, Yvonne. Thank you for having me. I appreciate it very much.
Please begin to share with us programs that are happening and tell us give us a little bit of background about community mental health. I know for many of us, we used to say just community mental health, and you got a new name. It's not new to some who maybe were born in the last few years, but for the old folks, we used to just know community mental health. So can you give us a sense of what your programs are at GHS?
Sure, absolutely. Yes, Genesee Health System, our name is Genesee Health System, but we are the community mental health agency for Genesee County. We've been around for well over 50 years, and we provide many services, integrated care. So not just mental health services, but we do have Genesee Community Health Center, which is an integrated primary health care center. So we provide lots of services. And our mission really is about supporting recovery, prevention, health, and wellness of the body, the mind, and the whole community. So at Genesee Health System, we serve adults with serious mental illness, children with serious emotional disturbances, adults and children with intellectual or developmental disabilities, also substance use disorders, including medication-assisted treatment, and we have integrated primary care, as I mentioned, at Genesee Community Health Center. So there we provide integrated care, which includes not just physical health care like you would receive at a doctor's office, but also behavioral health care. We have social workers and health coaches to help with mental health concerns as well. And we also continue to provide outreach for individuals affected by the water crisis. And we provide targeted case management for children and pregnant women who have been affected by the water. So we continue to provide those services as well. So during the pandemic, we are continuing to provide services at Genesee Health System. We want the community to know we are still here for you and we want to help in any way we can. Many of the services we are providing now are virtual. We do a lot of our contacts with the consumers and families we serve over the phone, and we also do a lot of video connections with people. And the state has been really good working with us in terms of allowing us to use different kinds of video platforms. So everybody uses their phones and different apps and things differently. So we have lots of ways to communicate with folks. But we also continue to provide face-to-face services. Some of our consumers need medication delivered that struggle with serious mental illness and need to have other face-to-face interventions. So we continue to provide those as needed, and we always use proper PPE and social distancing. Our office hours are still open Monday through Friday, 8 to 5 p.m. And we're open for access screening. We provide intakes, other assessments. We have our medication clinic open to provide those services, as well as the health center, which is across the street from our main building, is also open to provide services. It's very important that everyone knows that we provide crisis services at Genesee Health System 24 hours a day, 7 days a week, 365 days of the year. So I'll give you that number before we're through, but we want people to know that crisis services are always available. We do encourage everyone to call first because some of the services can be delivered right over the phone. If you want an access screen to find out if you're eligible for services, you can receive that over the phone along with many other services. So feel free to give us a call and we will find out how best we can serve you.
Thank you, Katie. And I know you were going to give us that number. I think they're...
Yes, I'll give you the number. The number is 810-257-3740, and I'll have it on another slide. A future slide, I'll give that number again, too.
Thank you.
Yes, and I just want to take a minute to talk about how important it is to practice self-care at this time, because it's a very difficult and stressful time for all of us in our community. And it's very important that we take care of ourselves and other people that we care about, our friends, families, and neighbors. So a couple things that are important is be aware of how much time we spent exposing ourselves to the media and social media and news and such. We want to stay informed, and it's important to know what's going on, but there can be a lot of information. It can be information overload. And sometimes it can be things that actually cause us distress or anxiety or frustration. So dial back on that if we need to. Very important that we follow our CDC and local and state guidelines. Suzanne went through some of the practices that we've all heard about and we know we need to practice. It's important, there's a reason we have those practices in place. Also, just to take good care of ourselves is really important. That we're getting enough sleep, that we're eating healthy foods, that we're getting out and getting some exercise. And this time of year, the weather's usually nice enough to get out and walk around. Fresh air is good for us, so be sure to do that. When we're in good health generally, we're better prepared to deal with the coronavirus or any other infections or illnesses that might come our way. Also, it's so important to stay connected in safe ways. You know, many of us use different kinds of apps and ways we communicate, Messenger and Facebook and different kinds of things. Whatever works, stay connected to people. We don't do well when we get isolated, when we feel isolated. So it's so important that we reach out to people. But a lot of the folks that we care about and love may not be able to have access to all the kind of technology that some of us do. So be sure to check in on people, the elderly and people who are homebound. Make a phone call to people or even write a letter the old-fashioned way so people know that we care about them and they don't feel isolated. So important that we feel supported by one another. Also, it's important to talk to children about what's going on. They see stuff, they hear things, they see people wearing masks. So they need to know that we're in a pandemic and there are things we can do to stay safe and protect ourselves. But it is important that we don't provide too much information or frighten our children because they need to be kids. So give basic facts and then tell them that we will keep them safe and keep them protected. Very important. Also, it's important to stay around people who are positive in our life, who uplift us and encourage us. it's really important and it's good for our mental health to keep us feeling well and feeling good. Also, we encourage people to do things that are enjoyable or relaxing, activities that bring you enjoyment and peace and relaxation. It could even be meditation or prayer or reading or whatever kinds of activities that you enjoy that are positive. It's important to do that. Also, we encourage people to get help. There's nothing wrong with asking for help. Many of us, in some time in our lifetime, will experience mental health issues. It's part of the human condition, just like we may have physical health challenges. So it's all important that we ask for help and we get the help we need. So we encourage you to do that. And I just want to remind everybody how important our mental health is, just as important as our physical health. And I want to encourage people to remember there's a lot of stigma about mental illness, and people are afraid to ask for help. And that's unfortunate, because we are whole persons and we have all different kinds of challenges in our life: physical, emotional, psychological, spiritual, and it's okay to get help. So it's always important at Genesee Health System, we want to combat stigma and let people know there's nothing wrong with asking for help, and mental health treatment works. We believe in recovery, and we believe in people getting well. So if anyone you know or yourself is having a mental health or substance use disorder crisis, please reach out to us and access our crisis hotline. Again, it's 24 hours a day, and that number is 810-257-3740. One more time, the number is 810-257-3740. Thank you so much, and remember, mental health matters. Thank you.
Thank you, Katie, and I appreciate you bringing it forward. We've kind of talked about this through the webinar, but there are a lot of crises on top of crises. And you mentioned earlier in your conversation about being available for those who have had some issues around the water crisis. And so I want to just emphasize that we know this isn't a crisis that's ended for us here in this community, but there is still support for those who have some challenges as it relates to the water crisis. And so one of the things I want to remind you is I'm trying to make sure our panelists are available to you, that Afton Shavers, who is here from the Greater Flint Health Coalition, and if you have questions about the Flint Registry, as an example, as a service for the Flint Registry, as it relates to the Flint water crisis, you can certainly put a question in the queue. She'll be there to answer that question for you. So again, thank you, Katie. And Katie has committed that someone from Genesee Health System will be with us for the next few weeks to answer any questions that you might have. So if you didn't get it in today, or you're talking with someone through the week, remember you can come back and we'll get that question answered for you in the next webinar. So again, thank you, Katie.
Thank you.
That leads us to another very important organization in our community that and it was already mentioned by Dr. Reynolds, the Genesee Health Plan, is also available for us here in the community as a resource. And Jim Melanowski, the CEO of the health plan, is here to talk to us about the health plan today. So please, Jim.
Well, thank you, Yvonne. Yes, I'm so happy to be here and just kind of share with what we're still doing at the health plan and some other issues, and I'll be piggybacking on some of the conversation that we already have. So if I could have the next slide and talk about the services so our bread and butter, what we really do is provide a healthcare coverage benefit for uninsured residents of Genesee County. That includes medical coverage, dental, and mental health coverage for the uninsured. On mental health, we heard just from Katie, so we cover outpatient services for our members. They can see a therapist, they can see a psychiatrist or a doctor, and then if they need more intensive mental health services, we refer them to our partners over at Genesee Health Systems for that type of care. Our medical coverage is more of an outpatient coverage, but it includes primary care visits, specialty, labs, x-rays. We certainly cover COVID-19 testing. We cover the telehealth visits that a lot of practices, a lot of doctors are using now. So again, I always say there should not be any uninsured residents in Genesee County. We have the Genesee Health Plan, and so, you know, please let us know if we can help you. Call us, and we can assist you in getting health care coverages. You know, with the increase of the uninsured because of people losing their jobs, I think it really does indicate how important it is in Genesee County that we have the Genesee Health Plan. I think about that often, whereas other counties don't have a program like Genesee Health Plan because they don't have the millage funding that the voters in Genesee County. And I'm reminded of that. We just had a primary election and how important it is to vote. And we are so grateful for the voters in Genesee County who have supported the millage for all these years, because it really is for times like this where there is, you know, uninsured, newly uninsured, and we can get them coverage through us, or we can get them enrolled into other programs. And you know, there are things that I worry about and it keeps me up at night, are, you know, what happens if there's changes in Healthy Michigan, our Medicaid expansion, or the Affordable Care Act, Obamacare. And I kind of want to piggyback on Anthony Turner's comments that the way we can ensure some of these things happen is through our voting. And so that's important for us to remember that to vote wisely and to know where your candidates are on these issues of covering the uninsured and healthcare for coverage for our most vulnerable in our community. We're still closed to the public. We did open our doors. We have a lot of people that are just so used to coming to our front door that I don't want to turn them away anymore. So we're opening our doors. We're still want people to call us, because we don't have a lot of capacity to see a lot of people at our office right now, but it's kind of look at it as like a soft launch as we continue to try to figure out how to maintain the safety of our staff and the community members that come in. So we just cracked that door open this week, and we're seeing how that goes. We do not like to turn anybody away or they think that we're not open. We have staff. We have a great staff that's available to work remotely 9 a.m. to 5 p.m. daily. And so, you know, again, our number is 810-232-7740. I will give that out later, but just give us a call and we can help and be a resource for you. As I mentioned before, we've had a lot of folks that in the community that have become uninsured. A lot of them for the first time, they're unemployed due to COVID-19. A lot of people have lost their jobs, as we know. And so again, thankful that we have medical coverage that we can provide based on those county millage dollars that come into us. And so we're very grateful for that. We continue to help people enroll into Medicaid and Medicare, and we help them understand their coverage. Our partners also can do that. I know enrollment staff at the Greater Flint Health Coalition and at the Health Department and in Hamilton and Genesee Health Systems. There's a lot of agencies that can also help with enrollment. And it's so important that this uninsured group, this unemployed group, that because of COVID, they can qualify certainly for Genesee Health Plan, but also for the Medicaid expansion that has occurring. And I look towards the fall and in the early winter when there's Medicare open enrollment, and how is that going to work? We need to start putting on our thinking caps on that period of time, especially working with our seniors and how we can work with them on getting their annual enrollment into those plans for Medicare. So some things for us to think about as a community moving forward. We have about 9,000 more enrollees on Healthy Michigan, the Medicaid expansion, since the start of COVID-19, more than 120,000 statewide. So this is that newly uninsured. So comparing the numbers pre-COVID to right now, It's about, there's about 45,000 people in Genesee County that have the Medicaid expansion, and it's up about 9,000, as I said. And again, I'm not sure how sustainable that is. I'm looking forward to seeing the governor's budget on what they're going to do with the Medicaid dollars. And I worry about keeping these numbers high like this, because this and those who about a year ago we were looking at work requirements and kind of reducing the amount of people that are on Medicaid in Healthy Michigan. Again, I think it's something that the community needs to be aware of, and we need to think about really advocating for Healthy Michigan and really having a coverage for these newly uninsured because of unemployment. We also provide dental coverage for seniors and veterans. And that's millage funded as well. It's a shame when we have a veteran who has served their country and they are not given dental benefits when they're discharged. And so we provide that at the health plan. Corey Taylor, our dental coordinator, is available for enrollment at that number, 810-232-7740. So if you know of a senior that doesn't have dental coverage, or a veteran, please have them give us a call. I think I just have a couple more slides here. So we can get people enrolled in the Genesee Health Plan. We can get people enrolled in Medicaid and Medicare, but healthcare isn't easy. I wish there was an easy button that made it easy for us to navigate. And so we have a team of health navigators and community health workers who are really, really good at making sure people know how to access care. It's good to have healthcare, but how do you access it? How do you get into the doctor? How do you get through barriers? How do you arrange transportation? That's what our staff is very good at. We work specifically with the Latino Hispanic community. We have a bilingual health navigator that's funded by United Way, and so we're thankful for that. We have a veterans health navigator who helps with veterans. We also have a women's health program where if women need mammograms and coaching for chronic health conditions, we offer that, and we do that at no charge for the people in the community that it's not covered as part of their insurance or healthcare coverage. A fun fact, it's Community Health Worker Appreciation Month, and a lot of your agencies that are on the phone right now, that they have community health workers, and we have a great team, and I would like to salute them. A lot of them are on this call. We work with, we have Flint, we're in the Flint schools, both charter schools and in the community schools and in the neighborhoods. We also have community health worker assigned to the Consumers Energy Payment Center there on Court Street. And that person now, since that office is closed, can be reached by phone for utility assistance for those utility shutoffs with Consumers Energy. And they're a great resource for that kind of assistance. And I think I have a couple more slides, and I will rehash this again because it's been emphasized. This slide is especially for Dr. Reynolds. In the fall, as soon as the flu shot is available, we're going to have our annual drive-through flu event. We've been doing this for a number of years, and talk about easy. We have garage bays here at the health plan, our office, and all people have to do to get a flu shot is come on in, and they roll down their sleeves, roll down their windows, roll up their sleeves, and they can get a flu shot done by a pharmacist. And we have an initiative that we lead called the Genesee County Influenza Immunization Education Partnership. That's a lot of words there, but we have partners such as the Health Department, Hurley, Health Alliance Plan, Walgreens, that come together, and we make it easy for individuals and families. There's no greater joy for me as a leader of an organization when I see a car pull up and it has a mother, father, a child, and maybe a grandparent, and they all have their windows rolled down, they have their sleeves rolled up, and they're getting their flu shot. And I can't emphasize how important that is, and we've heard it all before. And the health department's always available there at those events to also catch up children and adults with their immunizations. And so look for more information to come as we're really getting geared up for that. But call us 810-232-7740 for more information. And just again, we talk a lot on our calls about disparities and really reducing those barriers. And again, if we can be advocates for families to get their flu shots this year, and that whole intergenerational approach that we can have children and adults and grandparents doing this, it really sends a wonderful message to our children on how to become healthy and really to make some changes in some of those disparities.
Thank you, Jim. It's really important that we see the work of organizations that are partnering together, and appreciate the fact that our residents are ensuring that we're able to get this work done as a community. So thank you. We want to hear now from Gary Jones. Gary is our state representative out of the governor's office. Gary, what's the update for today? Can you unmute yourself, Gary?
Okay, can you hear me now?
I got you now, yes.
Okay, yeah, I thought I did do that. My apologies. So yeah, a couple updates here. So total confirmed cases for COVID-19 statewide are now at 85,429. Total COVID-19 related deaths are now 6,247. And total recovered COVID-19 cases as of July 1st are 60,022. And as a note, recovered is defined as the number of persons with a confirmed COVID-19 diagnosis who are alive 30 days post-onset. So recently, the governor signed an executive directive recognizing and addressing racism as a public health crisis, and also created the Black Leadership Advisory Council. The Michigan Department of Health and Human Services also announced their equity impact assessment process tool as well. Sumner took action to elevate Black voices in state government recently by signing an executive order creating the Black Leadership Advisory Council. She also signed an executive directive recognizing racism as a public health crisis, and also taking initial steps to address it within state government. The governor also, along with several other governors, including from Maryland, Massachusetts, Ohio, Virginia, recently came together for a major bipartisan interstate compact for 3 million rapid antigen tests. So this is a 6-state testing agreement, and it's the first of its kind among governors during COVID-19 for rapid antigen testing. This is critical as states face testing shortages and delays, and we're anticipating that more cities, states, and local governments may join the compact in coming weeks. Also, President Trump granted the governor's request to extend the Michigan National Guard through December 31st to assist with COVID-19. The president decided to only federally fund the Guard's activity at 75%, so it leaves the state of Michigan with additional costs to pick up. But he did grant the governor's request to authorize the use of the Guard through the end of the year. Since COVID-19 was first discovered in our state, the Michigan National Guard has been a crucial part of the emergency response, from conducting testing and screening, distributing personal protective equipment, and assisting at food banks across the state. And lastly, amongst the COVID-19 pandemic, the governor recently proclaimed August as Community Health Worker Appreciation Month. So this month, August, has been declared Community Health Worker Appreciation Month. And we're encouraging Michiganders across the state to take this opportunity to thank community health workers who have worked tirelessly to fight against COVID-19. And as always, as a reminder, Michigan.gov/coronavirus is still the best website to keep up with all updates.
Thank you, Gary, and you're giving us that right on time, the update there. We want to just remind you as we close our webinar today that you can join us every week at this same time at 12 noon, and we thank you for the questions and the information that you have been providing for us. because it helps us to build these webinars. And as you can see, we're getting more and more requests. So there's more and more information we'll try to provide for you. You can join us on our YouTube channel anytime, Healthy Flint. Help us to get that special page up for us. And then we also want you to email us if you have any additional information. Your responses to the pop-up post webinar survey is very, very helpful to us, and we appreciate that. We again thank you for coming to join us today for this webinar, and we ask you to join us next week, August the 14th, right here for the next HFRCC or Healthy Flint Research Coordinating Center's Flint Community Webinar on coronavirus. Thank you.